Heading into your retirement years brings a slew of new topics to grapple with, and one of the most maddening may be Medicare. Figuring out when to enroll, what to enroll in and what coverage will be best for you can be daunting. To help you wade easily into the waters, stay tuned to see 10 essential things you need to know about Medicare. 1. Medicare comes with a cost. Medicare is divided into parts. Part A, which pays for hospital services, is free if either you or your spouse paid Medicare payroll taxes for at least 10 years. People who aren't eligible for free Part A can pay a monthly premium of several $100s. Part B covers doctor visits and outpatient services, and it comes with a monthly price tag. For most people in 2017, that monthly cost is about $109. New enrollees pay $134 per month. Part D, which covers prescription drug costs, also has a monthly charge that varies depending on which plan you choose. The average Part D premium is $34 a month. In addition to premium costs, you'll also be subject to co-payments, deductibles and other out-of-pocket costs. You can fill the gap. Beneficiaries of traditional Medicare will likely want to sign up for a Medigap supplemental insurance plan offered by private insurance companies to help cover deductibles, co-payments and other gaps. You can switch Medigap plans at any time, but you could be charged more or denied coverage based on your health if you choose or change plans more than 6 months after you first signed up for Part B. Medigap policies are identified by letters A through N. Each policy that goes by the same letter must offer the same basic benefits, and usually the only difference between same-letter policies is the cost. Plan F is the most popular policy because of its comprehensive coverage. A 65-year-old man could pay from $1,067 to $6,772 in 2017 for Plan F depending on the insured, according to WICE ratings. There is an all-in-one option. You can choose to sign up for traditional Medicare, Parts A, B and D, and a supplemental Medigap policy. Or you can go an alternative route by signing up for Medicare Advantage, which provides medical and prescription drug coverage through private insurance companies. Also called Part C, Medicare Advantage has a monthly cost, in addition to the Part B premium, that varies depending on which plan you choose. With Medicare Advantage, you don't need to sign up for Part D or buy a Medigap policy. Like traditional Medicare, you'll also be subject to co-payments, deductibles and other out-of-pocket costs, although the total costs tend to be lower than for traditional Medicare. In many cases, Advantage policies charge lower premiums but have higher cost sharing. Your choice of providers may be more limited with Medicare Advantage than with traditional Medicare. High-incomers pay more. If you choose traditional Medicare and your income is above a certain threshold, you'll pay more for Parts B and D. Premiums for both parts can come with a surcharge when your adjusted gross income, plus tax-exempt interest, is more than $85,000 if you are single or $170,000 if married. Filing jointly. In 2017, high earners pay $187.50 to $428.60 per month for Part B, depending on their income level, and they also pay extra for Part D coverage, from $13.30 to $76.20 on top of their regular premiums. When to sign up? You are eligible for Medicare when you turn 65. If you are already taking Social Security benefits, you will be automatically enrolled in Parts A and B. You can choose to turn down Part B, since it has a monthly cost. If you keep it, the cost will be deducted from Social Security if you already claim benefits. For those who have not started Social Security, you will have to sign yourself up for Parts A and B. The 7-month initial enrollment period begins 3 months before the month you turn 65 and ends 3 months after your birthday month. To ensure coverage starts by the time you turn 65, Sign up in the first 3 months if you are still working and have health insurance through your employer, or if you're covered by your working spouse's employer coverage, you may be able to delay signing up for Medicare, but you will need to follow the rules, and must sign up for Medicare within 8 months of losing your employer's coverage, to avoid significant penalties when you do eventually enroll. A quartet of enrollment periods. There are several enrollment periods, in addition to the 7-month initial enrollment period. If you miss signing up for Part B during that initial enrollment period and you aren't working, or aren't covered by your spouse's employer coverage, you can sign up for Part B during the general enrollment period that runs from January 1st to March 31st, and coverage will begin on July 1st. But you will have to pay a 10% penalty for life for each 12-month period you delay in signing up for Part B. Those who are covered by a current employer's plan, though, can sign up later without penalty during a special enrollment period, which lasts for 8 months after you lose that employer coverage, regardless of whether you have retiree health benefits or COBRA. If you miss your special enrollment period, you will need to wait to the general enrollment period to sign up. Open enrollment, which runs from October 15th to December 7th every year, allows you to change Part D plans or Medicare Advantage plans for the following year, if you choose to do so. People can now change Medicare Advantage plans outside of open enrollment if they switch into a plan given a 5-star quality rating by the government. Costs in the donut hole shrinking. One cost for Medicare is decreasing, the dreaded Part D donut hole. That is the period during which you must pay out of pocket for your drugs. For 2017, the coverage gap begins when a beneficiary's total drug costs reach $3,700. While in the donut hole, you'll receive a 60% discount on brand-name drugs and a 49% federal subsidy for generic drugs in 2017. Catastrophic coverage, with the government picking up most costs, begins when a patient's out-of-pocket costs reach $4,950. You get more free preventive services. Medicare beneficiaries can receive a number of free preventive services. You get an annual free wellness visit to develop or update a personalized prevention plan. Beneficiaries also get a free cardiovascular screening every 5 years, annual mammograms, annual flu shots, and screenings for cervical, prostate and colorectal cancers. What Medicare does not cover. While Medicare covers your health care, it generally does not cover long-term care, an important distinction. Under certain conditions, particularly after a hospitalization to treat an acute care episode, Medicare will pay for medically necessary skilled nursing facility or home health care. But Medicare generally does not cover costs for custodial care, that is, care that helps you with activities of daily living, such as dressing and bathing. To cover those costs, you will have to pay out of pocket or have long-term care insurance. Traditional Medicare also does not cover routine dental or eye care and some items such as dentures or hearing aids. You have the right to appeal. If you disagree with a coverage or payment decision made by Medicare or a Medicare health plan, you can file an appeal. The appeals process has 5 levels, and you can generally go up a level if your appeal is denied at a previous level. Gather any information that may help your case from your doctor, healthcare provider or supplier. If you think your health would be seriously harmed by waiting for a decision, you can ask for a fast decision to be made, and if your doctor or Medicare plan agrees, the plan must make a decision within 72 hours.